Hello there, my name is Morgan and I am a nurse practitioner here at the hospital, and I hope you are both feeling better after your procedure today. And I understand there are a few clarifications that need to be discussed regarding your wound healing between the two of you. And surprisingly, wound healing is a very highly complex process and requires multiple cellular activities to facilitate tissue repair. And right now, you are probably experiencing the early stages of wound healing and with your surgical incisions. And you could probably notice that the incision feels hot, red, it might be tender, warm to touch. And this is expected when we are doing stages of wound healing, and this is very beneficial to the body. So when you were in the procedure, what happened first when the surgeon was slicing you open and first kind of sealed you back up, your blood vessels clamped down extremely hard to prevent the bleeding, and all these clotting factors raced in there to make sure that you wouldn't bleed everywhere. Well, now we're shifting more towards this stage where all these white blood cells and enzymes and antibodies are coming to the incision site to help progress with the healing process. And all this extra protection also wards off any risk for infection. So it's actually your body's immune system fighting, and that's the response. All these inflammatory mechanisms that cause the pain and probably the soreness that you're feeling now. And as you are probably discharged in the next couple days, you're going to shift into a different stage of wound healing, and this is called pleuration. And this is when the blood vessels in the tissue start to develop. So you're just kind of rebuilding tissue that was damaged before. And you'll start to see more of a shift into a pinkish color, which is expected, and you might actually notice some weird drainage coming out of there. Don't be alarmed, that's okay. That's just fibroblasts, which is another it's a mechanism that helps build new tissues. So that's completely normal, and it's just helping create these bonds in the wound. And the final stage of wound healing can actually take up to 2 years. And the wound will completely close up, and those fibroblasts that we discussed about earlier, well, they'll continue to become stronger. And there'll be less kind of activity going on there, so you won't be experiencing the redness or tenderness or even some discoloration. You might have a scar depending on how the site heals and how moist you keep it, but it should not be nearly as pink or red and as painful as it is right now. And in a younger adult such as you, Jane Doe, the wound healing has little to no barriers with proper care of your incision. However, since you're in your 60s, Jane Doe, on the other side of the room, you have a couple barriers that are against you here. You have some comorbidities. You have you're in your 60s, that's a higher age. And with comorbidities, you probably take a couple of medications. So that's called polypharmacy. And with all these extra medications, that can influence how well your wound healing goes. And also, as you age, you just have decreased integrity of your skin. And in the skin, you have the epidermis and the dermis. So the integrity and just the general function of those two layers of your skin just start to decline. So that also impacts wound healing. And as you age, you just have more issues because your skin is so much more fragile. You might struggle with skin tears, or you're at a higher risk for pressure ulcers. And sometimes medical devices can ruin your skin too. So with you being at a higher risk, you may have noticed that your care is a little bit more different than younger Jane Doe next to you, and you might see that they are more adamant about you getting out of bed. You might be on some antibiotics, either on the incision or through your IV or orally, and that's just sort of a prophylactic action. So on top of what your body is doing to fight infection and promote wound healing, we're adding in another extra layer of protection for you. And we are looking at the dressings and the incision and being noticed of what the drainage is. So you have a lot of eyes on you to make sure that you aren't getting an infection. We're monitoring your vitals. And so we are doing a lot of different things to help reduce complications that could be associated with wound healing at your age. And also too, you getting out of bed in recent studies have shown that it actually improves wound healing. Not only does getting out of bed and moving around prevent pneumonia and blood clots, like I said, a recent study showed that that older adults who were mobile after surgery had increased wound healing rates. So that's something to take into consideration. And I hope that I was able to answer all your questions. I will be here for a little bit, and so if you guys have any concerns or any further questions for me, you let me know and we'll continue this conversation.